And so good morning and welcome to this Jersey Chamber of Commerce web chat. My name is Murray Norton and I'm delighted to be with you today to talk about face and nose coverings and indeed new public health guidance, which is on the way to you. I think we've only seen the first issues of this coming out today, but it's a good time to be talking about it. I can see at the moment that of those who've registered, they are all logging in at this time. So just be patient with us. We'll try and get as many people on the webinar at one time, and then we can begin and start from there. We've had almost 60 people register for this, so it's going to be quite a busy one. For those of you who've just joined, thank you. We haven't got underway yet. We're just waiting for more of the participants who've registered to join the webinar. As I'm doing so, let me just point out that at the bottom of the screen, you'll see a little screen that says Q&A. Q&A there means that you can ask questions. So please do feel that if there's a question that you wish to ask that you don't feel is being covered, then please put that forward and we'll try and get that covered to you. The man answering most of those questions is going to be Martin Knight, who's the Head of Public Health Policy Strategy and Planning, and in any particular order. And he joins us live, and it's good to have you with us, Martin. Thank you very much for being there. Representing retail in terms of food retail, Mark Cox, the CEO of the Channel Islands Co-op, and non-food retail that you will know very well, Gruchy, the store director, is John Marquis. John, thank you for joining us as well. And to those who've just joined, welcome and good morning. Martin, can I start with you, because we've heard political and public health guidance on face masks. I think we've more often said, but nose and mouth coverings for some time. In fact, since the beginning of the pandemic back in early March, and we've seen this in other places as well. So where does Jersey stand at the moment in terms of nose and mouth coverings?
Okay, so I think, as you mentioned, obviously, as an island, we've had policy around face masks. It was actually kind of mid-April that we first brought forward policy around face masks. Part of the reason why it didn't come through initially and as fast as other jurisdictions is it was one of those kind of more contested issues as we were early in the COVID scenario. And there was kind of mixed evidence base around their use at that particular time. As evidence seemed to be starting to build and there was a little bit more confidence in the kind of benefit that face masks would bring, that's when government committed to bring forward the voluntary face mask guidance in, it was mid-April. But what we've seen since that period, I think, was relatively kind of like well endorsed, endorsed both by the retail sector and by islanders as well. However, what we've seen over the period, while risk has been relatively low and while we've had the ability to have a few more freedoms and enjoy ourselves a little bit more as an island over summer, that those kind of behaviours have waned. But alongside what we've seen is kind of like very low numbers and very low risk previously as we were moving through the summer. At that particular time as well, we were avoiding, there's some differences in terms of where we're at now. So because PPE was at a premium, we were encouraging avoidance of kind of looking at people trying to purchase those medical surgical supplies. And therefore, at that particular point in time, we had policies around cloth masks, snoods and scarves. And we kind of nuanced that up in the new guidance in terms of recognising that we're in a slightly different position. So at the same time back then as well, things that affected retail was thinking about, we were at the same time encouraging use of the screens and hand hygiene in retail environments, and that rolls over into the new position as well. So why are we doing this now? I think that's probably has been a question. It's been a question from the public since Richard Renniff announced that we were looking at mandating face masks. Effectively, our ministers, whilst looking at the overall strategic response to reducing the risk to COVID-19 and balancing the risk of COVID-19 in terms of kind of making sure that we're protecting islanders, but at the same time maintaining kind of well-being and maintaining the island's economy as well. But as we've scaled up the risk and we've seen risk increasing in both Britain and Europe, ministers are committed to bringing forward a breadth of different preemptive measures to try and keep our numbers as low as possible, although we have seen those creeping up. So a number of different measures, including workforce screening, looking at some of the wider issues around hospitality, bringing forward some of the workforce screening and building our contact tracing approaches are some of those commitments that have moved forward over the most recent period. What's happened at the same time as building risk, we've seen an increasing evidence base for using masks specific to COVID-19 mitigation. So previously, when we were at the early stages of COVID-19, a lot of the evidence around masks was around mask use for seasonal flu, for SARS, for MERS, and for the swine flu. But what we're seeing now is much more direct evidence that's available relating to COVID-19 in relation to what other jurisdictions have been doing. So what we're seeing more commonly now is that masks, evidence around masks is that actually that they definitely do prevent the projection of respiratory droplets. So that's the main cause of the kind of spread of the virus. So we know that reduces risk from people unknowingly passing on the virus to others. So that's what we call source control. So it's not about protecting the individual, it's protecting people who might unknowingly have or asymptomatic infection, so not passing that on. So that's really helpful. And we also know now that masks seem to be increasingly linked with reducing the risk of community spread, particularly when they're put in place alongside other mitigations. So those are the kind of underpinning rationale, the building risk, the building evidence, and being able to ensure as far as possible that we can reduce community spread.
Okay, Martin, there's a question that comes out of this straight away, and I'm sure it's a question that lots of people are itching to ask. You talked about community transmission. And you know, I'm the last person in the world with any qualification whatsoever to question medical science on this.
Yeah.
But when it comes to community transmission, we don't have any in Jersey, or we have very little. That's not to say that we might not in some time in the future, but where we are right now, we don't have community transmission. So the question might still remain, why are we trying to introduce face coverings when we don't have that?
Right, so this is a really difficult question. I'll answer it from a public health position, and similar questions are being discussed across ministers and across the Assembly as well. So from a public health perspective, you know, I think across jurisdictions internationally, as we've seen virus increase again, particularly in our side of the world as we move into kind of autumn and winter, the majority of jurisdictions, no one's wanted to imagine that they could be the next jurisdiction that moves forward, that starts to go into kind of epidemic phases of infection. What we see is what happens in other jurisdictions is you get kind of silent movement, if you like, of infection. It spreads most commonly, first of all, in the much younger age groups, and does so asymptomatically initially. And then it starts to build from that point of view and move into the older age groups. And then we start seeing people becoming more severe symptoms, and then we start seeing people hospitalized. So that's what we started seeing across the whole of Europe and Britain. It was like, well, we don't have to worry. There's no risk. We're not seeing anything happen in the hospitals. Let's not move. And then incrementally and increasingly, obviously, we've now seen that risk happen in the majority of our near neighbours. In fact, Jersey and Guernsey effectively being a small kind of small, not COVID-free, but low COVID environments in amongst that different world. So what we've seen is the borders loosen, change in terms of having some flexibility to keep our connectivity. And ministers have made that decision, balancing the risks. But what we have seen over the period is the number of infections kind of increase from a Jersey point of view. And in some cases, as that policy moved forward, people who have been then found to be positive cases that have actually been allowed to move around the island, advised not to, but then finding that we are in cases. So we're seeing people linking and having infections whereby they might have been out to the pub, they might have been out to the shops, they might have been around to dinner to a friend's, and we are increasingly seeing kind of that risk starting to increase. So if you think about the number of cases, in September we had 41 overall positive cases. Midway through October, we had 81. And that's in the face of the number of people travelling to the island reducing at the same time. I think it's a really careful balance. I think the majority, from a public health point of view, if you're not seeing it happen, but you're starting to see early signs and signals, you should start taking actions early, because as soon as it spreads, it will spread. And then it's really difficult to be able to manage and control it from that point of view without putting in more stringent measures, which obviously have those wider negatives as well.
Okay, I'm going to bring in our two leading retailers that we've got with us here. Mark, first of all, you've got a double responsibility, one to the many staff that you employ, and also obviously to your customers as well. Where's the Channel Islands Co-op on this right now? Because this is going to be another upheaval, one of many that you've had during this period.
I think I've certainly done a sort of 360 on this, Murray, and I'm fortunate that had a call with Martin earlier in the week to understand the sort of guidance being issued. And I sort of accept that we've taken a risk-based approach on this all the way through, and we've provided the relevant PPE, masks and shields, face shields, to our colleagues to wear, and we've left it up to them during the summer months whether they wanted to adopt that PPE. But I think, based on the latest research that's coming out and the benefit of coverings, I think as part of this and then the latest guidance issued is we'll be insisting all of our colleagues wear face shields as of now. So we're rolling those out again across our stores. And I think if we can do anything to help control any spread, and there's the slightest risk, then we would prefer to be covered. I think the conversations with Martin and the team in government are around, we've got to win the community over on this. So there is a lot of people that are very sceptical, and why would they adopt face coverings in stores? So rather than seeing regulation, I think I prefer the approach that we're educating our customers and those out shopping as to the benefits, but I don't want to put our colleagues at risk in having to enforce something that you've seen in the UK, rising levels of aggression to retail workers. And so I support the government's approach of tackling this as an educational piece, and there's further sort of promotional campaigns being launched next week to help guide the community as to why it's important they wear the covering. So broadly supportive, but recognise it will be challenging for retailers and the community to adopt this approach based on not seeing that level of community spread that's being seen elsewhere.
Yeah, John, going to bring you in here because this is a challenge for the likes of the supermarket, obviously, with the footfall they're getting through, and with the till systems and everything else they've got in the narrow aisles. For a department store such as yours, that you're a store director of, face masks really, or face coverings in any form, and I've worn one in stores. It doesn't make me want to hang around and mooch around the shops and do retailing as I used to do. Your mentality is much more get in, get what you need, and get back out again. That's a challenge for a retailer such as yourself, isn't it?
Yeah, it is. I've got to say, I think Mark summarised it really well there. Obviously, we've been hit by this since early in the year, and the initial stance for the store, I'm sure many other retailers, was to recommend the wearing, and we provided masks, we provided screens, along with all the other sanitising and hand washing equipment we needed. So it very much was a safety first approach. I suppose as time evolved and we went from 1 metre to 2 metres, thankfully from a commercial aspect, that sort of eased things. And I suppose we've seen the community and colleagues in store all become more relaxed with max wearing. We've recently gone back again with training and development sessions with colleagues throughout the store, I guess to reassert the position that the government are strongly recommending the wearing of masks, and therefore we do the same. I think that the challenge we've got is until it becomes mandatory legal requirement for both customers and for colleagues, we get pushed into the middle here. So we see some colleagues take the recommendation and we've got more mask wearing, but it's certainly not comprehensive. So it was interesting to hear the co-op's point of view with their colleagues insisting that they wear it. The risk, as we see from a transmission, comes from preventing the wearer having droplets as opposed to the recipient. So it's really got to be the wider population that has to respond to this. In terms of business and commercial, I guess it's the person that's wanting to shop on impulse. I'll just pop into the Gruchy's. I haven't got my mask. What do I do? that will be the impact from a business perspective, as far as I can see from UK evidence. And I think at the time before it became mandatory in the UK, there was only 21% of the population perhaps wearing masks at that stage. It's how we move from that, 21% to 80, 90, or even 100% requirement.
Yeah, really valid comments, and certainly always having a mask with you. And I've parked the car, wandered down the street, suddenly realized I haven't got a mask. Well, do I go back to the car, or do I just not go and do that shopping now and do it at a later time? The challenge here is going to be educating the wider public, Martin. I've got questions for you that have been coming in. David sent in a whole raft of questions. Will it be a compulsory requirement? You can answer that fairly quickly.
Yeah, so currently we're moving to a kind of a building push towards encouraging mask use to try and support customers, islanders, to consider the risk. It's that kind of civic responsibility. I think you're very right. We do have a really challenging message to deliver, encouraging islanders to actually see that actually this is an opportunity for us to try and stay in a much more stable position and not find ourselves in similar positions as other people. At the moment, obviously, I mean, people are interested because we first started hearing about this when Richard Renniff announced in Assembly that we'd be bringing forward regulations on face masks. So in terms of in context, we've got phase 1 and phase 2 regulations. We've updated and revised the workplace restrictions and various other infection protection laws earlier this year after the summer. And we're now moving into the phase 2 of that, which is looking at trying to build, if you like, the government's toolkit to make sure if we should find ourselves moving towards more of an epidemic curve in the island, that government have the powers, if you like, to make sure that we can operate the contained policies that we need to put in position to protect the public. So I think, and it's difficult because obviously those powers that we're seeing is really quite unusual for the Assembly to be having to manage and think through when it affects people's personal freedoms. So it needs to be seen as a toolkit. Government are really committed to making sure they're only putting in regulations that are proportionate, that are necessary. So we are preparing those regulations in relation to face masks, for face masks to be mandatory. The commitment for ministers is to proceed with the law drafting on that, but watching what happens, understanding what happens in the community as we move forward through a campaign and encouraging and moving islanders through that. I suggested it'll be interesting to see. We will be putting those efforts in, and we've had some really kind of positive feedback initially around trying to get those consistent messages and support from retail to make sure that islanders are getting that kind of one clear, consistent message moving through.
So encouragement now, belt and braces legislation might come along later and only be used if it's needed. Would that be fair to summarise? Yeah,
definitely. But I think we'll be looking to assess that, looking to see what the take up is. Looking to get retailers' feedback on how it's working, what the challenges are from a retail perspective. We get feedback, there's some evidence from other jurisdictions and from public saying actually mandating it is easier, not having a choice is easier. So, but our ministers will have all of those challenges to understand and to move towards. Just for your information, in terms of the drafting, it's being done as a kind of a pincer drafting movement, if you like. So they're being drafted into the workplace restrictions. So there's on one hand, a legal responsibility from business and drafted into other regulations to make sure there's also a legal responsibility on the individual. What that will do is it will mean, for example, that businesses will be able to discharge their responsibilities more easily. So we won't get that kind of, it avoids or allows us to avoid, should we move forward with that approach and should it be accepted by Assembly? But doing that kind of approach means that business can discharge its responsibilities. They should be ensuring someone wears a face mask as they enter their business premises. If the person refuses to do so and can't be encouraged to, the service shouldn't be provided. But to discharge your responsibilities at that point, if the authorities are then contacted, you've taken every reasonable step you can as a business, then the enforcement side can come through. And because the responsibility is equally on the individual to be wearing a face mask, there's an individual breach of the law there, so they can be managed in that way. So it should, in that way, make things, if we require it, if it's supported, allow that to work a little more smoothly if it's needed.
Okay, I just want to come back on that in enforcement, which sounds like a very, very, draconian word to be using in this when we're talking about encouraging people and getting the message over. So you don't want to steer too far away from that. But Mark, you mentioned this earlier in terms of people wearing masks and the experiences you have as shopkeepers, as retailers. People act differently when they're wearing a mask, and I think people are on edge. And certainly there have been incidents of people getting reasonably or more overtly aggressive, let's put it that way, than they would have otherwise been. I mean, how's that from a retailer's perspective? Because that's a tricky one to handle, isn't it?
I think none of us want to see our colleagues come under any increased pressure, and levels of aggression and abuse have risen. They've risen locally. During the course of the summer, we've had some challenges with our colleagues in terms of the abuse that they've suffered, and certainly everybody will have seen the videos on YouTube, etc., from experiences in the UK. And in some instances, there's very valid reasons why somebody wouldn't wear a mask, for medical reasons, etc. And for our colleagues to have to manage that and challenge individuals as to why they're not wearing masks, I want us to be able to avoid that. So I think the personal responsibility piece, absolutely accept. But equally, what you have seen in the UK is the sort of people ganging up on individuals that aren't wearing masks, and it brings out a whole host of sort of levels of behaviour that you really don't want to be seeing. People trying to enforce behaviour that they think somebody should be wearing a mask. Medically, they've got a reason why they shouldn't. And how do you manage that? That becomes very, very difficult. So I don't want to see our colleagues put under that level of pressure to be able to have to enforce something that could be problematic.
Okay, Mark, thank you for that. I'm going to come back in a second to John with more on that. Before we do that, though, questions that have been coming in during the week leading up to this. Sharon works in the hair and beauty industry, Martin, and wants to know questions. She said, I've got so many questions, and I'm going to go through this. Will the government give clarification if this is to be extended to the hair and beauty industry? The hair and beauty industry, those in that industry are quite close to the people that they're serving one way or another, and presumably wearing a face covering whilst you're having a haircut is going to be almost impossible. So again, difficult to police all of this, but they're looking for some guidelines there. So that's one part of it. Will their guidelines be updated accordingly? They want to know, is it expected to be mandatory? I think we've already asked that and reviewed. Will clients be able to remove masks to take a drink, as they're going to be having a tea and a coffee whilst they're having treatments? So there's plenty of questions in there for the hair and beauty industry. So presumably that's almost another piece of work, because they're part of retail, but they're a different sector.
Yeah, so Murray, I mean, the answer to that initially is the hair and beauty sector have guidance. That guidance will maybe small nuanced changes to that guidance might be required. They're already required to wear masks as part of the guidance that's strongly recommended in that sector. It's just, and some of the colleagues in that sector have continued to use masks for both customers and for their staff throughout, and others have chosen to move away from that over the period as the risk is reduced. I think one of the things that we put in place, or we're encouraging, is towards the face screens in that kind of retail customer facing environment. And I know a number of hairdressers initially, when using cloth masks, were quite unhappy with hair parts kind of around in that environment, very uncomfortable, itchy. And I think a number of people have experienced that. At the moment, we think that still should be personal choice, but actually the risk can be reduced now. And there's building evidence that face masks are effective. The face screens, so that's the Perspex face shields, are effective in reducing virus transmission and protecting staff. And also they, if you're going to have to wear masks over a longer period, they don't get damp. They can easily be reused, cleaned, and really importantly, they do aid communication, not just for those people who are hard of hearing, but just for everyday people that do rely on facial expression, and that's important for that kind of customer experience.
Do you see that face masks, because people who are working in retail particularly and in the hair and beauty industry will be wearing masks? Are masks something that the consumer should be looking at as well? I mean, presumably for communication purposes, a mask is, a clear mask seems to be, to me, a more comfortable, slightly more freedom giving and easier communicated way of doing it. So should we all be looking at clear screens?
I mean, at this point in the stage where we are, the guidance as we've kind of these kind of final draft guidance we put together at this point in time allow those freedoms. And I think we're working with this voluntarily. We can work with understanding, with feedback to see how it's working. And our view from a policy point of view is about we need, as far as possible, to reduce the spread of infection. We also, as we're going through this mask campaign, it's not just about masks. We know that mitigations need to be grouped together to have the overall impact that we're looking for. And it's getting boring. And I mentioned this to colleagues. Chief Minister keeps telling us to wash our hands, doesn't he? It's really trying to understand when you wash your hands, why it's important, what does it mean around physical distancing, and if you like, masks are part of that distance. They're reducing the distance that viral particles may be spread by putting a mask on, but that doesn't mean that we can stop doing physical distancing. We need a number of these key actions and activities that are transmission breaks that can reduce the onward movement of the virus. So we've tried to write the guidance this time at this point in time where it allows a certain degree of flexibility. So whilst we are recommending, we think it would be best in the kind of customer facing service industries, if you're using masks, to be using the clear face shields. That might not work for personal choice or for personal reasons. So we're allowing it to still allow that masks of choice. I think, as you mentioned, Murray, they do tend to be more comfortable, particularly for those people who are going to be requiring or needing to protect themselves over longer periods. And that's why we've allowed that.
Okay, comments coming in and plenty of them, and thank you for these, and it's the Q&A box at the bottom if you want to answer them. We've had two people anonymously saying, can visors be used by shop assistants instead of masks? Clearly yes. It's better for customer service, people can see a smiling face. Surely that will help in these circumstances. Agreed. Barbara, are face shields good alternative, and a face shield's acceptable, or does it have to be a mask? So I think we've answered that one, and thank you to the three people that put that comment up there straight away. There's also one from Marion who said, are there plans to issue exemption style badges as in the UK for those who for health reasons are unable to wear face coverings? That's a really good question, and certainly having that identification that there's a reason why you can't wear a face mask and it's clear without someone having to challenge you. Is that something you're looking at?
I think it is, yes. And the challenge at the moment when we're moving forward the policy towards voluntary face mask use, you can't put an exemption in something that you're strongly recommending. We're just saying, for example, in the guidance, examples of times of when face masks wouldn't be used. And first and foremost, we are saying for children under the age of 11 don't need to wear a face mask. There are various other scenarios that people are aware of where there's disabilities. Obviously, if you're putting a face mask on, you need to be able to safely remove that face mask yourself for safety reasons. There are environments where identification is really important, emergency situations where that kind of open and free communication is really important. Although we're moving this and encouraging that it should be used on public transport and in including buses and taxis. We know they're in buses at the moment. Some of the taxis want to see that happen. Some of them are worried and challenged by some of that. But obviously, for a driver point of view, if it's going to interfere with safety in driving for individuals, some of us who are wearing glasses and face masks at the same time, that could be a challenge. So we're trying to provide that flexibility within the guidance.
Okay, David, thank you. He said, gentlemen of the panel, it's hard to wear a face mask correctly. We all have to accept the numbers of probability and do our best by the guidance given, and we will. He's a retailer. I would point out that you have collectively touched your face 18 times in the past 5 minutes, all of you. Fortunately, we're all in separate places and we'll all be washing our hands afterwards. But thank you very much indeed for pointing that out.
I do have my sanitizer, Murray. So
yeah, it's just out of reach. Well, excellent. That's what I like. This is the kind of rebuff that we need. Thank you very much, David, for pointing that out.
I think I'd just make a point on those masks, Murray. I think from our point of view, again, supportive government approach around the face shields, because there is a risk around managing face masks, and so we will offer our colleagues a choice, but the preference for us is face shields because they're far easier to clean and maintain. And as David's already highlighted, when you're wearing a mask, you're constantly trying to touch your face, touch your mask, and having to change these frequently and clean them properly. So from our point of view, managing that risk is far easier for our colleagues if we're using those face shields, and they do aid that communication, as we've highlighted.
Excellent, good. John, on what you've heard so far, and obviously, you know, dealing with the stuff that you're dealing with and all the concessions that you deal with inside your department store there, this is about retraining a great deal and having more meetings with staff, isn't it, and getting them on side.
Yeah, definitely communication and education across the board, and whether it's what we class as our own board colleagues or concessions, Murray, everybody abides by the same regulations from a Gruchy perspective, and I'm sure that's the same in many other retailers. We've got communication boards, we have our briefing sessions on a Tuesday morning. I think, as I said previously, we'd followed the government guidance by encouraging mask wearing again. We've seen a little bit of an increase in uptake, but you know, we have to go as far as the co-op to insist all colleagues wear masks to get full compliance. And I think, you know, we're probably a little bit reluctant to do that until it becomes mandatory, because of the diverse opinions we've got from both public and from colleagues in store. I think one of the challenges we will have with multiple entrances to the unit is how we manage and control that, and that level of responsibility. I think it would be extremely difficult for a small retailer or a retailer like ourselves to control the behaviour of the consumer, and that's where we're going to need help and support. You know, for the start of the year, when we were trying to get people to sanitize and follow flow routes, as with Mark, we found abuse to customers, abuse from customers to colleagues on a frequent basis. I've just come out of one shop, I've been sanitized there, why do I need to sanitize again? So we need to take those challenges and stresses away from the colleagues who are already working under fairly difficult circumstances.
I'm going to go to Harriet, who put a comment up, which was, going into the busiest time of the year for retailers, masks, whilst I completely understand and support their use, will have a huge negative impact on the retail sector. I want to come back and talk about that in just a second, Martin, if I may. It also takes some of the joy out of shopping, especially for gift shopping. Any advice on how we can still encourage shoppers onto the high street? Question mark. Huge concern, which is this move, which I support, but I don't know that many people love a face mask. That will force people back online after such a brilliant shop local and shop small message from the spend local card. So, you know, you've got this last couple of weeks, if you like, of spend local cards and people with money still on their cards. You're encouraging them to go out, and at the same time, we've got this message here, which is bound to have a negative effect on shoppers. That surely, Martin, something that, whilst you deal in health, you know that your ministers and those who are making the political decisions on this must take into account the economic impacts, which I've got from several questions already.
Yes, certainly. You know, when looking at the options that that governments, that communities have in the face of building risk for kind of such, you know, virulent, easily spreadable infections, you know, unfortunately, you know, the way we interact as humans really facilitates that. You know, it's the friend of the virus to a certain degree in terms of the way we behave, and unfortunately, a lot of the best approaches in reducing the impacts and reducing the spread are those very things that actually require us to spend and to be separated from one another in whatever ways possible. And I think, you know, to a certain degree, you know, if we do look around us, you know, if we'd get in a helicopter and then kind of like look at the spread, and you look at the maps that we're seeing kind of in terms of the kind of spread of virus, and those majority of, because very little, if we talk about red, amber, green, which I suppose we all know about from country risk, it's very difficult to find anywhere that's not looking red around us. You know, Jersey's in a very fortunate position. You know, we have the opportunity to reduce risk. I think if we look at the way the virus behaves, to expect that if we do nothing, for the virus just to kind of like for us to get away with it, if you like. Yes, Jersey is different in terms of the way we move around. It's a smaller island. We don't have that same city public transport environment, but equally we are a very sociable island. We are very well connected with one another as well. So what we will see things move. And I think the fear is actually if we work together now as a community to try and put in place those things that we know that can do its possible best to keep things as safe and as low as possible, we can stay in that position for longer. I think the risks otherwise, if we don't take action now, we look at what's happened in every other jurisdiction that's around, if we don't try and tighten carefully, cautiously, whilst recognising the wider well-being and economic impacts, then the risks are greater to the economy of the island, and with more stronger message. And it's difficult from public health. That's not a threat. It's a reality of the way the virus behaves and the way we see those projections kind of happen. I think we weren't lucky last time in terms of Jersey not seeing an epidemic spread. We'd mitigated against that. Our borders were closed. We stopped the seeding of new infection. That's why Jersey's been in a lucky position. And then over summer, as we've increased that, virus numbers everywhere have been low, but we're seeing that increase now. And I think we are in a position of we're seeing the likelihood of escalating cases. I mean, let's see what happens with the borders as people stop traveling less. We might see that reduce down, and therefore then the number of positive cases coming in that we can contain, making sure that we're identifying every single case. The teams are working so hard around direct contact tracing all of our indirect contacts, making sure that any specific cases that come through the island are kind of really tracked as far as possible. Those systems that government has put those resources in are working doubly hard now we've moved into autumn. So what can we do more to keep us in this safe place? So we do recognise those wider economic impacts. Ministers collectively are really concerned about and trying to balance those risks, and wouldn't like to be in their position in terms of having to make those decisions.
Tough position being a politician. Philip says, to be absolutely clear then, masks are strongly recommended, but they're not mandatory. Can we
Correct.
just get correct? There we go.
Yeah.
We dealt with that. And
it's probably worthwhile saying in terms of clarity for this, so we set some kind of key principles, Murray, as well. So what we're saying is we are recommending that masks be used in those settings whereby you're in an indoor place, where it's a crowded environment, where you can't guarantee that you will be able to maintain physical distancing at all times. And in addition to that, an environment where your contact details aren't being kept, so you can't be contacted if you might have become at risk. So that kind of captures a certain amount of the retail environment as well. So to be clear, you won't need to be wearing a mask walking down King Street or Queen Street. So outdoor environments, masks won't be used. That means that in gyms, and when exercising in indoor environments, you won't need to wear a mask. Thank goodness, people are saying. So we've had some of those inquiries. What happens if I'm just going to stop going if I have to do that? It just sounds terrible.
Yeah, I'll definitely stop going to the gym if that's the case. That's me. My 7 day a week in the gym will stop.
And at this point in time, we've been talking with ministers of people around the kind of service settings as well. So hospitality sector, around drinking, around cafes, around restaurants. Do we want to be encouraging people to wear a mask as they walk in and then take off that mask instantly as they've moved through? Is that something we're going to do in the first instance? No, it's not. We might need to move to that as risk increases, where you need to put a mask on, you sit down, and then when you move around the building, you need to put a mask on again. It's a bit more of a challenging environment. We do know that we've got a number of different mitigations. So if businesses are following the guidelines, we can reduce risk to islands already in those environments. So but equally, we are saying we would encourage in that environment where we've got service orientated staff that are mingling between different customers, in which case we would be strongly advising wearing visors in that environment, because they're not having to stop and drink and eat in that environment.
Good, because you answered one of the questions there, which was about food and beverage, and is this being spread to there? You're still working on that guidance in terms of any changes that will be to food and beverage, because they have track and trace, whereas retailers don't.
That's right. So at this moment in time, the recommendations and the key principles we put together doesn't capture that specific environment. And that is about understanding risk, and it's understanding balancing that risk, and it's understanding what makes sense to people. I know a lot of people have expressed real frustration when they travel to Europe and other places. Oh, what's the point in this? But it is good. It's a static seated service, so that kind of makes sense to a certain degree. But the risk still kind of is spread around that. So at the moment, no. But I would say from that point of view, we might need to encourage mask use more broadly speaking, other environments as well. So we've listed those kind of environments where we kind of expect to see those environments. So supermarkets, pharmacies, banks, post offices, some of the petrol stations that have got retail environments within them. We are moving that to taxi shelters and bus shelters. So that readiness for people when they're moving into taxis and buses, recommending that people are kind of doing that in that environment, working tightly with our taxi colleagues as well.
Right, we'll come back to where people can get all this guidance in just a moment. Some specifics, if I may. Ross has been in touch, and Ross, thank you very much for joining us. What about opticians? How can spec frames be selected and fitted correctly when you're wearing a mask? Eye tests are a real issue. The trial lenses steaming up with a face mask on. Do certain businesses get exemptions from wearing their consumers having to wear a mask or a face covering?
At this point, obviously, because exemptions are what you need to put in place when you mandate something. We give advice in terms of where they may or may not be used. At this point in time, the opticians are regarded as part of the allied healthcare group, and they have advice and guidance on PPE. It's difficult where do you draw the line between one sector and another. But quite often some of those people are then using other healthcare services as well, so trying to reduce the risk as far as possible in those environments. Yes, we look to provide guidance as far as possible with mitigations. So, for example, we've done the same in the guidance with retail. And this was questioned by some of the colleagues previously, and people with experience in retail to us saying, well, when we got a perspex screen at our counter, do we need to wear a mask? So what we're saying at this point is actually, and if you're comfortable that you've protecting your customers, your staff by perspex screen, you've risk assessed that, and there's no risk there. You've got the barrier. There's no risk of viral particles being spread from one to the other. Then no, you don't need to wear a mask in that environment as well. So if you can put various different mitigations in place, then that's fine. I think where, for example, in those close contact retail environments or allied healthcare environments where people have to be they're close contact for a reason. Nail bars, some of the beauticians, if you're performing a massage, if you're going to see an osteopath, if you're seeing a physiotherapist, some of that happens in the community as well as with clinical settings as well. Yet you need to be wearing protection when you're coming close to people in that kind of environment, because you're not able to physical distance. So where you're not able to get that 1 meter or more, then we need to put other mitigations in place.
Okay, all right, thank you for that. Can we get new government posters asking or suggesting customers to wear masks? Is that part of the media output that government will be supplying? Because that's going to be, I can see Mark nodding straight away, that's going to be really helpful to have a consistent messaging on posters that people can see.
Yeah, so we're looking and preparing those pieces of work as we speak. At speed, because ministers want us to proceed with this as at speed to kind of put those preemptive measures in place. That's been one really key message from a number of colleagues saying, actually, it's really helpful for us if we have clear, consistent messages that are really unambiguous, with some visual cues. So we'll have a number of different things. We'll be resetting the campaign that we've got. So masks are one thing, I've said this already. We do need to reset that. So we do need to help and support these behaviours, recognising that it's not just masks. We do need to look after our hand hygiene and encouraging people when they move from one place to the next, where you can be bringing kind of touch point risks from one environment to the next environment, particularly if you're moving from home to work to retail, and also making sure that we continue to do that physical distancing alongside a raft of other kind of wider measures in the community. All of those things can help work together to reduce that risk. So we need to be able to reshape that campaign, and we're looking to reshape that campaign over winter as we expect and anticipate the overall risk of community transmission and spread to heighten. As mentioned, we've seen those numbers increase in terms of the virus, potential virus coming into the island, virus positive tests coming into the island. So we're changing that in terms of that, protect, prepare, making sure our island is ready, getting those key messages together. And we look forward to kind of feedback to support what's working, what's not working. We kind of adjust some of those messages as we move forward as well. But a new campaign, a new feel. I think we're kind of moving away from the bright yellow banners. So we'll kind of look to try and reshape and reset the campaign. That's part of the old way where we've all waned our behaviours collectively as an island have reduced as we've been able to enjoy the summer, enjoy those freedoms. So we're going to reset that and work together to support that broader campaign, and that'll be across a number of different channels as well.
Okay, I'm assuming, John, from a department store, that's the ideal consistency that you'll want throughout, isn't it? Really, that messaging and that help from government to help retailers get the message over as well.
Yeah, the initial campaigns were really successful and I think quite clear. So to build on that and support that, we all want to put the right things in place, Murray, to make sure we do stifle this virus. So it's doing all the right things at the right time. I think one thing that would be important is to get advanced communication and notice of when we move from recommended to mandatory, if that happens. Sufficient timelines to be well prepared to deal with what we need to be preparing.
Okay, thank you. And just to recap on Ross's opticians, it's not mandatory at the moment, so it is really recommendations and also following the healthcare guidelines that you would have as well, as far as opticians are concerned there. So at the moment, you don't have to wear masks. It's not mandatory, but strongly recommended wherever possible. And I'm sure it's not possible when you're doing eye tests. So that's probably one of those areas. We've also got Ruth, who said, can you please tell me where I purchase a face visor as opposed to a mask? Because that's something I would like to purchase, maybe as an employer or maybe as a consumer. Are they readily available? Does anyone know? They are presumably online, Mark, and presumably you have your sources.
Yeah, we went direct to a supplier given the volume we needed, but there are some local wholesalers that have them in stock. And if you are struggling, last point at call, if you can't shop local, as Amazon do have some on their website as well, but there are local wholesalers that have them in stock. Okay,
wherever possible, we'll try and help where we can and put people in the right direction. Ian says, I've been to the UK a couple of times recently, and in general, people seem to be very happy to wear masks. We seem to be talking quite negatively about it. Perhaps we can take the glass half full approach and add a positive spin to this. So, Ian, I think we're looking at the impacts, but I take your point, and we've aired your comment there. In terms of looking at it more positively. I'm going through these questions because we've got 13 minutes of the hour left, and we've seemed to have gone through it fairly quickly. Joanne has come in with a comment. Surely people serving food in restaurants, roughly the same as someone preparing food, such as a butcher. So who are included in this guidance? They're handling plates and glasses, which droplets could be transferred to. So for those working in restaurants, do we recommend that they wear masks when they are serving and when they are delivering food and preparing food? Martin, to you.
So yes, we do. And again, encouraging face shields in that environment, particularly. And the reason for that being they're obviously going to be wearing masks over a longer period. We've talked about our unfortunate human trait to touch our faces as we move along, particularly then when you're wearing a mask. If you've then got your own droplets, you're then touching, you're then putting onto the glass or the plate that you're serving, increases the risk, increases the need for kind of a real stringent hand hygiene. So again, preference towards using face visors in that environment. So in the guidance, we do advise that those service staff and customer facing staff are encouraged to move towards face screens. But again, at this point, it is voluntary. It is about trying to support as far as possible that civic responsibility. So leaving those choices open for staff. Some of them might find those face screens challenging and difficult, but in which case, if you're needing to wear a cloth mask, hand hygiene becomes even more important at that point. Access to hand washing. Hand washing is better than using a sanitizer, in that that we know the virus is broken down by those soaps and by the warm water, and also washes it away. I mean, obviously then when you're using hand sanitizer, it's breaking it down, but they're all broken particles, but it's not as efficient and effective as hand washing, but brilliant as an option to be used in between. And I think that's the things we're looking to encourage people to be taking the opportunity. When you go into the supermarket, you move it, you use your hand pump. And we've got them on the buses, but I go on the bus quite regularly myself, and it's like, actually, it's there for a reason. I've just come in from my own house. Did I wash my hands? I forgot. Okay, into the bus, put my hand sanitizer on. I'm breaking the risk of having brought back any infection that my family might have brought back into the home and spreading that into public areas.
I just wanted, you mentioned buses there, actually. I just wanted to pick up, and I've been on a couple of buses recently, and I've noticed that and actually in some of the stores as well, for this matter as well, the varying degrees of how you wear a face mask never cease to amaze me. And even when I watched TV last night, there was someone say, well, people aren't following the guidelines. They were doing that as they spoke with a face mask somewhere halfway down their mouth, no covering over their nose whatsoever. Is the wearing of a mask that complicated, Martin? It is the mouth and the nose that needs to be covered. Is that correct?
It does seem to be overcomplicated, doesn't it? Yeah, there's part of the reasons why we're saying masks, or mouth and nose coverings. And obviously a shield is a bit different than a mask, so it's a bit nuanced, isn't it? But effectively a shield protects, it stops that projection of those viral particles. The virus will come out of your nose as much as it will come out of your mouth. We do know, obviously, kind of about the way the virus is, respiratory virus through the throat, it does come out, it attaches itself to the mucus, then it's projected out when we're talking, when we're breathing, when we're sighing, when we're yawning, and when we're singing, when we're shouting. But let's not get into singing at this point in time.
No, let's not. Well, there's a lot of singing going on in retailing stores right now, and I can just see it happening. Before we go in, I just want to wrap up on a couple of comments here. Laurie, who's been doing a great job at Jersey Business, by the way, the hands, space and face UK posters appear to be particularly effective to assist messaging. So maybe something to consider there. So I think that's a good comment, and they seem to have worked particularly well. And Barbara says, what would be the recommendation for a bakery environment? High temperature in the bakery can make it very difficult to work in a mask or a visor, because of the high temperatures that they're working in. So again, lots of specific detail in here, Martin, that I suspect, from a head of public health policy perspective, you need to look at each one of these individually. Because
yeah, no, certainly. And I think, we're dealing with a lot of policy in a lot of areas. We are policy people. Certainly we're kind of evidence kind of informed, and that kind of feedback from the shop floor, from people who understand how it actually impacts in reality, is something we're more shy on, if you like, in terms of, or light on, sorry, not shy on. So any of those particular issues that people are concerned about, encourage people to put that in either through government, through our 1GCT email, so we can understand that and look at those nuances as well. Really appreciate that kind of high temperature, high heat environment. Before making any comment, I'd like to look at the evidence, look at what we understand. I mean, the important thing is we do know that obviously when we ingest foodstuffs, the kind of, when we're ingesting, kind of, the risk is really, really very low. But we need to look at that, look at the advice, making sure that other mitigations are in place, making sure that as far as possible the advice we give is as clear and as current as possible in reducing risk, both to staff, to the business, to customers.
Right. Okay. Yeah. You've got a lot of takeaways from this, and one of them is definitely bakeries, and another one there is probably the hair and beauty industry, and probably opticians as well as those. So any nuance on the guidance that you can give there will be very helpful to Chamber members. This is one that I'm going to put out to all three of you, and it's quite a good question to be wrapping up on. Although we've got a couple of comments in. Amy has said, we've spoken about the impact of aggressive behaviour can have on employees who are trying to help facilitate safety guidelines, i.e. sanitizing on entry and then being challenged. Should mask wearing become mandatory? Is there an option for some guidance or training for people to deal with conflict resolution day to day? So I'm going to put two questions in there. One is conflict resolution, because that's there are ways of asking people to do things and ways not to. And I suppose the other one really is, should it be mandatory? We've already heard John say earlier, probably easier if it became mandatory, then we'd all know where we are. So, which seems, Mark, going back to what you said, is a real 360 from where we started. So it's a tough question. I'm going to start with you, Mark. Do you think mandatory is the way forward?
I think the challenge I have around mandatory is exactly that point, is you put your colleague in the position of then having to seek to enforce it. And that's the challenge for me, is that putting our frontline colleagues who are already going to be very busy, particularly in the run up to Christmas, and in some instances won't be trained, as well as police dealing with these types of issues receive years and years of training. To a retail colleague on the front line insisting that somebody puts a mask on and deals with that conflict. So I'm reluctant around the mandatory, although I accept it may force people's behaviour and change it. I much prefer the education piece, and that we grow into this and try and seek to change behaviour that way. I think the other point I would make on the guidance is that, happy to share some of the stuff that we've got, with chamber members as a large retailer, and I'm sure there's others that are out there. We've made the offer to share our risk assessments. They're complicated, they're big, but it may help people in terms of understanding some of the areas we look at. And if we work together as retailers, some people have some advice and training that they naturally already undertake, and happy to help in any way we can, because recognise this is difficult, particularly for some of the smaller retailers.
Mark, we'll take you up on that offer. That's very, very generous. Thank you. And if there are retailers that want to learn from good practice that you're already carrying out, that would be really helpful. John, from your perspective, you're at this stage where it's difficult to make all of the staff wear a visor if they don't want to. But the strong recommendation is they do. You're kind of caught in the middle, aren't you?
Yeah, I think Mark's obviously taken one approach. We're taking a slightly different approach at the moment because the general public have got this choice as it stands. I think the question about mandatory is mandatory at the appropriate time, gives us a lot of clarity, and perhaps as part of a communication message, we've seen the government do the spend local cards, the £100 cards, very, very effectively. Maybe they could send 2 or 3 washable masks, jersey branded, to every household as a way of supporting that communication message. We could see lots of people supporting Jersey in a visual sense. In terms of the training and the dealing with challenges, any support and guidance there for how to deal with people effectively is always welcome. So in addition to the government guidance, if that is available across the island, that again will help.
Oh, I love that. I love that. Never mind sending them a card. Why don't you send them a couple of masks, a couple of visors? We could all have a Jersey visor, couldn't we? Martin, over to you on that one. Good luck in selling that one to the Council of Ministers.
I was going to say, I look forward to that proposal. I mean, I think the emphasis here is on, as an islanders, is on all of our customers, about us individually. How do we move forward? How do we get that wider support? I think that's important. I think, and I understand from a retail perspective, that's really important as well. You need to move at the pace of your customers, and equally, it's our job as government, if this is our recommendation, to do what we can to try and enable that change as far as possible as well. And it's great to kind of start hearing back the support that we have from some of the retailers, or from the majority of the retail sector, and ideas, as well as concerns. So if you were to move towards, if it felt like the right thing was to move towards mandatory, that there's islander support for that. If we're doing regulation, you need to have people support as far as possible as well, people that wider understanding. It needs to be enforceable. So it doesn't need to be, people need to uptake it. It doesn't need to be a minority behaviour. We need everyone to behave in that way as far as possible. And then sometimes that kind of additional kind of a fallback to regulation can be helpful. But that's some of the decisions that we will see move with islanders. We'll see what our ministers want to support. I think protection, let's hope we can move together forward as an islander to make sure we can try and reduce the risk as far as possible. Be protected, be prepared to be protected as we move into winter, working together. And I think that is the first port of call to work together to do that. Thank you,
Martin. One final thing from you, and we are 2 minutes to being out of time. Not that anyone minds, but we've all got other things we need to get on with. Martin, in terms of the guidelines that we've got, I noticed the guidelines only coming out today. Where can people read the guidelines? Where can people be updated on the guidelines? And if you're a retailer right now, you're saying, right, what are the rules? What aren't they? We've touched on a lot of it, but there's quite a detailed draft public health guidance that I've seen. That's published somewhere that people can see it now?
Currently, we haven't published that, no. I think I really much appreciate that people want to get hold of that. we've put it out in confidence at this point of view in terms of what we're moving forward on, and that's mainly on the basis that we need to make sure. So, for example, there's been changes that have moved through the guidance that need to go through some governance decision making. Dr. Muscat will want to be completely happy that before we finalise that, before it's completely released, then that's available. I think we need to make that available to all of the retailers as soon as possible. I'm happy at this point. We need to get it up on the website as final draft guidance, which we tried to do as we move towards the different levels. So we'll make sure we communicate that through you so people can access it as quickly as possible.
I can show you a glimpse of it, or I could show you a glimpse of it. Perhaps I can't now, but I will try to. No, I can't show you a glimpse, and I will not try and do so, because I'm going to be too clever and mess up the end of our broadcast. So I'll make sure we don't do that for the moment. But thank you very much indeed for everyone for joining us today. We've had plenty of good conversation, and certainly great questions as well. So my appreciation to Martin Knight, the head of Public Health Strategy and Policy. My appreciation also to the CEO of the Channel Islands Cooperative, Mark Cox, and also to the store director of Gruchy as well. Thank you all very much indeed for joining us. And we are very grateful to all of the questions that came in today. And if anybody wants more information on this, obviously get in touch with us at the Jersey Chamber of Commerce if you're one of our members, and we'll be very happy to relay that on. And if you joined us at some point late to this, or you didn't see all of this, then it will be available to watch on YouTube at a later point. So thank you all for joining us. We look forward to talking to you more on more of the webinars here on the Jersey Chamber of Commerce. Mark, John, Martin, thank you, and good morning. Is it still morning? No, it's now turned into afternoon. Good afternoon to you.
Thanks, Murray. Thank you all. Yes, bye.